Hi, everyone. Welcome to today's Career Chat. I'm Krista Harmon, a workforce development consultant with the Kent ISD, and I'm so happy to have Dr. Autumn Killop with us today. Welcome.
Thank you very much. Appreciate y'all having me.
So Dr. Killop has a PowerPoint. She's going to kind of share some things with us today, but I know, Dr. Killop, we'd love to start with that, taking us back to kind of high school before you start your slides. Were you thinking you'd grow up to be an optometrist? Kind of give us that initial thinking before we get your PowerPoint going.
Absolutely. So I'm one of those weirdos that knew what they wanted to do pretty young. I was at my annual appointment over the summer before I started fourth grade, and I have two younger siblings. My mom went with one, dad went with the other, and they were like, "You're old enough and mature enough." And so when the tech dropped me off in the exam room and I was by myself for a little bit, I had to touch and play with everything because I was 9. And then when the doctor came in, instead of, being grumpy about it, he asked me, is this something you're interested in? Can I show you? And so he let me look at his eyeball and the microscope, and he let me do one or two. And so from then on, I was very interested in it. I actually got to shadow him my senior year of high school when I was a part of Health Occupational Students of America. And that really came around seeing, as a on my way with the career path, this really does seem like something that would work out well for me.
Well, kudos to that doctor for taking that minute and instilling a little dream in a young girl. That's absolutely fantastic. I love that story. So I'm going to kind of pass over the baton, let you get going, and then I'll just interject anything that I'm curious about.
Sounds good. All right. So, Krista reminded me that I forgot to update my LinkedIn, so I'm gonna have to do that soon. But recently I did change jobs. I am currently working with Grand Rapids Eye Care.
There's lots of initials behind your name, so we'll have to find out about those.
Yeah, for sure. So the OD is my Doctor of Optometry. The MPH is my Master of Public Health. I did my doctorate and my master's at the same time. One, because it was cheaper that way. It was a dual degree where they took into consideration my doctorate. But also, when I got into my first semester of optometry school, I realized optometry was in a very small part of a very big medical world, and I just wanted to be better prepared for my patients. And then the FAAO is the Fellowship of the American Academy of Optometry. I'm very interested in teaching in the future, and so that's something that they like to see, whether you're a preceptor for rotating students or actually working at a college of optometry.
Thank you. And I love that you've already given such a great insight that you can actually get some dual degrees that will, so already a great tip. Thank you.
Yeah. So just wanted to go over things like, what my journey was like, including the rotations that I've gotten to do, the service trips that I've gotten to do. I actually got an email today that I'll be able to talk about later. Just day-to-day tasks, projects, problems, and then recommendations that I have for people moving forward. So I'll start with high school. I grew up on the east side of the state in a tiny little town called Armada, about 2,000 people. From there, I went to the middle of the state, went to Central Michigan, Fire Up Chips. I was in the marching band there, left or stopped in the marching band my last year so that way I could focus on getting ready for optometry school. Did my biomedical science major and then a minor in American Sign Language. I have used so much sign language in my career already, and it has already proven to be very effective, very useful. There are many ocular diseases that unfortunately also involve hearing. Yes, it's become way more useful than I ever thought that it would be, and it was fun to learn at the time. So 2 for 2 there. Then I headed south.
On that, I know that students are often very concerned about picking the right undergrad major. Can you give some insights there about, does it matter if should you get biomedical? Could it be a biology? Could it be even a nursing degree?
That's a great question, for sure. Colleges love to see that you are good at time management, whatever that looks like for you. So I actually changed majors. I was a standard biology major and then realized that there was more classes on that major route that didn't work. Whereas if I did biomedical sciences, it included my physics and other things that I did. In my class at optometry school, there was a music major. There was a chemical engineering major. As long as you get all your prerequisites done, the colleges aren't very picky on what your major or minor was.
That's great. So kids have just know young people that you can take a breath and it's going to be okay. The undergrad, you're going to be able to get where you need to. Thank you. Keep going.
Absolutely. So after being in tiny little Mount Pleasant for 4 years, I got a little stir crazy. So I actually headed south to Southern College of Optometry in Memphis, Tennessee. SCO is very ingrained in the Memphis community. And so that's how why I was able to pursue the dual degree that I did. SCO has relations with both the University of Memphis, where I did my MPH, as well as Christian Brothers University, which that dual degree is a Master of Business Administration. Once I graduated from school from both degrees in May of 21, I moved back up to Michigan because I missed it, and I did a residency downtown at Cherry Health, the Community Health Center. I learned so much in my residency. I heard a lot during school that, only about a third of people do it. As I mentioned earlier, I really want to teach. And so that was another reason why I was very gung-ho about doing it, but also the experience is priceless. There are things that I learned both from a public health perspective, from a patient care perspective, from a growth as a human being perspective. Residency really changed my outlook on what I was preparing myself to do both as a doctor and as an eye doctor. I want to treat.
Just to clarify, to be a doctor of optometry, it's completing that additional 4-year degree, but you don't have to do the residency.
Correct.
So I just want to clarify that so young people understand you don't have to do that extra step. It's because it was going to serve your next career goal.
Correct. Only about a third of optometry students do a residency. The rest just go right into the field, whether it's working for places like Eyeglass World or going into private practice like I'm in, or joining. A lot of times people will move back home to, doctors that they've shadowed or worked for in the past. That's pretty common too.
Thank you.
Welcome. So then from there, completed my residency, started working at Grand Rapids Ophthalmology. I was there until December of last year. After I started at GRO, I was able to finish my prerequisites for getting my fellowship. So this is me in San Diego in 2022, posing with my I did it sign.
Tell us what a fellowship is for young people that might not know what that means.
Yeah, that's a great question. So for the American Academy of Optometry, they are very academic focused, and they are very learning the new and the best, and making sure that the care that you are bringing to your exam room is the most up to date, whether it's through technology or medicine or even holistic things. There's lots of dry eye recommendations that we do with patients, like warm compresses or making sure your eyelids are clean by using baby shampoo. And so there's lots that go into when you are treating a patient. Actually, to be honest, I try to treat the whole patient, not just their eyes. And so this fellowship opened a lot of doors for me in terms of, if I want to teach one day, also if I have future students or residents that want to, go through their fellowship, I'd be able to better guide them through that process. There was a couple of papers I had to write. I presented a poster at a conference in Kansas City, Missouri. And then once I had my fellowship, now I just have to keep it up by going to, completing so many points over the course of 10 years, I believe it is. It's very chill once you have it, and it's very nice to have.
And you get paid for that? Is that also a financial thing?
Good question. Sometimes the private practices or the schools that you work for will pay you for that. But when it comes to the organization itself, you get some discounts on conferences and whatnot. But a lot of times they encourage you to balance out the price discount that you get to donate to the foundation and things like that. And so now, like I mentioned earlier, I work at Grand Rapids Eye Care. Nice, beautiful rainbow there. So, starting on clinical related things, I was able to do a lot of really cool traveling in my 3rd and 4th year at school. My first rotation was at a IHS out in Bethel, Alaska, in the middle of the southwestern tundra. So way all the way up there in the top corner. While I was there, I was able to service people in Bethel, which is that big city right in the center. I also was able to go to Akiak for a village trip because all of those cities that are on that map are places that the YKHC services. That area is about the size of Oregon, and there's about 26,000 people scattered everywhere. So like I said, flew up to Akiak in a little bush plane to help people there, and then took my preceptor's boat down to Killop to do some village exams there. The hospital was getting a makeover while we were there, so that was super cool to see it go from being, what it was before to a more modernized, exciting looking hospital. This is me, my preceptor, and one of the other students in front of that bush plane that we took out to Akiak. And this is me and one of my other students that I was with, and my preceptor's back of his head on the Kuskokwim River that we took again to get to Killop for some village exams. There's the hospital in the background and all of us students that are standing on the stairs by where we were living that summer. So we all just walked, which was super cool.
And I think this is something kind of unique about your training is that you do have those rotations as part of your final years that you get to go to different places in the country to actually physically do part of your learning and training. Is that because that seems different than maybe being a medical doctor?
For sure. I know in medical school, a lot of times they get like a base hospital where they do a good majority of their rotations. In optometry, you can have anywhere between 3 and 5 rotations, depending on the school that you choose. Most places I would say do either 3 or 4 rotations. There's only, I think, 1 or 2 schools that do 5. And so with the way that Southern College of Optometry does their rotations, you do one in-house at all the different specialty clinics. So contact lens, low vision, pediatrics, technology. So we got to learn how to do things like doing an ultrasound of the eye, how to interpret certain blood work, because we, as optometrists, see a lot of diabetic eye evaluations. And so that's what the in-house rotation that fall of 2021 that I listed. So that was back in Memphis, Tennessee at my school. When they also do, every school does a little bit different in terms of what kind of rotations they want you to do. So SCO there was 2 different kinds that you would do. You would do what's called an institutional. So you would do like an IHS, like what I did, or you can do a VA, see patients across the country who have served for us. You can also do like a big referral center, so like a Grand Rapids Ophthalmology, if that would have been, a rotation through them, or other bigger institutions like that. Then the other rotation that they have us do is a private practice one, because Southern College of Optometry is very private practice oriented. And so the one that I did was in Connecticut, and that was a pediatric focused practice. I saw ages 0 to 15, and I saw a lot of patients that were 60 and older, because a lot of times pediatrics binocular vision tends to overlap with neuro-ophthalmology. So brain injuries, strokes, when people lose parts of their vision, you can teach them how to appreciate the vision that they have and still be able to successfully navigate through their world. I know other colleges of optometry, universities that do optometry, every school is a little bit different. And so it's definitely something to take into consideration when you are figuring out which school you would want to go to, depending on if you want to do 4 rotations versus, specific rotations tailored to what kind of practice that you would do. Definitely all important stuff to be looking at.
Was that part of the consideration of choosing SCO, or how do you even pick which type of optometry school you want to go to for young people that are wondering, how does that happen?
Of course. When I was looking into what optometry school I wanted to go to, somebody somewhere told me, give them a call, reach out to them, see, what kind of things that they would want you to do to prepare, like just start that networking process early. So I called 4 schools before my junior year, or leading into my junior year of college. I was on the phone with one of the people at Ferris, so the Michigan College of Optometry, for about 15, 20 minutes. I also called Illinois College of Optometry, and I was, again, like 15, 20 minutes. I was on the phone with somebody from Nova Southeastern, which is in Fort Lauderdale, Florida. I was on the phone with them for about 45 minutes. And then I was on the phone with SEO for about an hour and a half, just chatting about, how I've always wanted to do this, things that I've done to prepare, what else I could do to prepare. And so that was really the first like giant green flag was, wow, that was a wonderful conversation. I would love to, and it wasn't even something that was like top of my list, but it definitely rose up to the top pretty quickly. And so the in-person interview definitely sold it for me. The clinic was very impressive. Every single person was so, so sweet. I mean, it's the South, so the food was amazing, but no surprise on that. And so it felt like a place that would come to be home away from home, because I don't even know how many hours I spent at that school. I couldn't study at home. I would get myself distracted by whatever I could in my apartment. So there were some days where I was at my school from 7 a.m. until 8, 9 o'clock at night.
Yeah, I love that. That kind of sets an expectation of part of that grind that is going to be intense. And we'll definitely dig into, depending what you're sharing. I do want to ask you more about what you did to prepare that you could share during that interview, and we'll get to that. But that is something I'd love to ask more questions, but I don't want to interrupt your PowerPoint list.
Yeah, towards the end, I definitely have a section talking about recommendations.
Great. But I love it. It was that feel. There was that connection that you had.
Yeah, for sure. So this is the one that I got an email update today that I'm really excited about. So also fun things that I've been able to do throughout my school career, but also into my actual career. I've been on a couple of really awesome service trips, one to Ecuador, one to Belize. And the email that I got today said that I am invited to go back to either one of these. So hopefully in May, I will be back giving exams to people who maybe don't have quite as good of access. This is Ecuador, Salinas, where we did the one when I was a student. Here's all of us with our interpreters I think this was after day 1, so that's why we're still smiling. We do 4 days, usually see about 800 patients. And then 2 years ago, I went to Belize. Their primary language is actually English, so I didn't get to practice my Spanish as much on that one, but still amazing experience. Here's us with all the staff that helped us out. And that was the last day. So very surprising that we're all still smiling in that one too.
Yeah, 800 patients. That's intense.
The Belize trip, we actually broke a 28-year-old record. I was spoiled with some amazing students for my first trip as a staff doctor. We broke the record by seeing actually over 1,000 patients when normally they saw around 850.
Wow.
I put in a little fun video here. After we do clinic, we have a couple of resort days where we have some fun. So that's me feeding a tarpon while we were out exploring around Belize. So going into things that I do on a day-to-day basis, if you have, contact lenses that you wear, if you need an updated pair of glasses, get your eyes checked, routine care once a year, once every couple of years, I do those. I was given some information earlier about medical things that we also do. We do a lot of diabetic eye exams, glaucoma. I think I diagnosed like 2 or 3 people with glaucoma in the last couple of days. Autoimmune disorders, a lot of autoimmune disorders show up in the eyes in terms of dry eye, in terms of red eyes. And so when patients come in and they don't know what's causing it, sometimes we have to run blood work to figure out what is causing it. And a lot of times that end up being things like psoriatic arthritis, rheumatoid arthritis, a lot of itises, inflammation things. We also do, so that kind of leads into the next one, the urgent, emergent, if someone's got a red eye that came out of nowhere, or they've been sick recently and it maybe traveled up to their eyes, if someone's been in an accident. I had a patient a couple months ago that accidentally got herself with a pair of scissors. I didn't press, but also ow. Foreign bodies. So like when people, lose a contact in their eye, I had a patient like that this week. Or if the people who are outside trimming and, get a leaf stuck in their eye or something like that. Or a lot of times mechanics or welders that weren't wearing their eye protection will end up in my chair, and we got to take care of that. I talked a little bit about this earlier when we were talking about residencies and what kind of residencies that you can do, but the different specialties that people tend to do them in are ocular disease, contact lenses, pediatrics, low vision. Mine was a combination between public health, ocular disease, and primary care. So making sure I'm able to do the the vast majority of things, but mainly to know when it needs to go to somewhere else bigger and more important. So like a retina specialist, a cataract surgeon. Today I had a guy whose glaucoma was so bad that he's lost vision that he's never going to get back. And that's not exactly something that I want to be starting with just an eye drop. That's not going to do a whole lot. I want him to see a specialist. That way he has all of the options in front of him right away.
And I think you bringing up that part of the conversation is that some young people may not understand the difference between an optometrist and an ophthalmologist. So if you could just give us a real quick difference there.
Absolutely. Optometrists like me go to optometry school. There are 26 optometry schools in North America, one in Puerto Rico, two in Canada, but there's also like 5 more, I think I heard, that will be opening in the next couple of years. The Detroit Mercy is actually hopefully starting their first class this fall. Ophthalmologists go to medical school, and so they go through the 4 years of learning about everything, and then they narrow down to the eyes during their residency and fellowship. A lot of times they have to do both because they are doing surgery. So a retina specialist, for example, 4 years of medical school, 4 years, 3 to 4 years of their residency. And then after that, sometimes they will do a surgery fellowship, which can be anywhere between 1 to 3 years.
Yep, that's great. I just want to clarify that as, like you said, the foreign body, if it was stuff, you might be referring them up to an ophthalmologist, just so young people understand the kind of the scope of practice there.
Absolutely. The really cool thing is, so when I did work at Grand Rapids Ophthalmology, it was really cool to be able to be down the hall from some of these people. That's definitely something that I already miss. But I also know that I can tell my patients, hey, go down there and they'll get the same thing done. Having that collaborative care is something that like I said, I definitely will miss. So talking,
Just so you know, we have about 6 minutes.
awesome, thank you. Just talking about some opportunities. I've probably talked about this a little bit already, just, places where you'd be able to work. So Community Health Center, where I did my residency, an IHS where I did a rotation. You can work as a teacher. You can work as a MSL, so the medical science liaison. They work for companies that sell different products. And so they do that. You can do administration. You can exclusively do research. And with every profession, there's always going to be problems, hurdles that you're trying to get over. So like you mentioned, what's the difference between optometrist, ophthalmologist? Optometry is trying to get a little bit of surgical freedom in terms of removing lumps and bumps and doing some surgeries with lasers. There's already 12 states that have these opportunities. So maybe one day in the future, I would have something like that. And the third one is really the reason I'm doing this. Most people don't know what optometry is and how awesome of a career it is. There's so many things that I have opportunities to do that, I can, again, if you look at all the things that I can do with my profession or options avenues, there's really a part for just about everybody, I would say.
Yeah, I just want to give a plug that for young people, you can actually get into an optometry office as a tech right out of high school. So I just want to put that out there. We could talk if we have time at the end.
Yeah, absolutely. So that's you perfectly transitioned into my slide right here. So yes, my biggest recommendation is get in the office, or maybe it's not optometry, you pick whatever career that interests you, get there, whether it's to shadow somebody for morning, afternoon, or maybe like Krista said, get a job there. That was probably a regret of mine going into school. Was it wasn't even something that crossed my mind. I was like, I'm gonna go work at McDonald's, I'm gonna do this, a job that revolves around my schedule a little bit better. But there were so many people in my optometry class that were really well prepared because they had been a tech for so long. Volunteering for sure. There were lots of clubs that I was able to do eyeball related volunteer work with, and that was great to have on my resume. And then extracurriculars, again, you want to show optometry schools or any graduate school that your time management is stellar. So if whatever you have to offer, go for it.
Yeah, I think that's a big tip for today is to make sure that you're not just school. That won't
Yes.
play well when it's time to get admitted into an optometry school.
Agreed. One thing that really impressed me was one of my classmates was a athlete in college. That's how they got their scholarship to get through school. And then she was also the music major. I don't know how she did both. That's just insane, but she did it.
Cool.
So yeah, my last thing just basically says what I've said a few times throughout this. Optometry is wonderful. Not that I'm biased. And so I figured I'd leave some time for questions.
Well, I have a few as we finish up because I'll have you share your final word of wisdom shortly. But I know a lot of people want to know, how do you do optometry with babies?
Yeah, so pediatrics is one of my favorite things, mainly because I'm a kid at heart, but also when you're doing younger eye exams, a lot of it is objective. You have to be the person collecting the data and you got to be quick and you got to know exactly what you're doing. So I actually found out that I have a 0-year-old in my schedule next week, so I'm excited about that. But yeah, you use certain lights, certain devices, instruments, and you gather your data and then you tell the parents what you find. They're some of my favorite exams.
That's great. And then in high school, what would you recommend for young people who are still in high school? I love the volunteer suggestion. Certain classes they should be pushing themselves, take more science and math kind of things, bio, advanced AP, or maybe
Absolutely.
yeah.
Mhm. I would say definitely a good balance of, showing again that you're interested in this, but also again, if you can manage your time in such a way that you want to be able to do band while also doing a health science extracurricular, there are ways to do it as long as at the end of the day you have showed that you are interested and you can handle what grad school has to offer. That's really what they look for.
And then my final question, when a student might be interested in a job shadow, is that something that your previous employers or your current employers encourage high school, or do they need to save that job shadows for more college age?
I actually have a high schooler that will be shadowing me later this spring once my schedule is a little bit more regular. But yes, I had people shadow me at my last job. I'd be more than happy to let people shadow this time around. It again, the quicker you can get out there just to even see what it is, because you might read it on paper and you might hear things, but until you are in the exam room experiencing it and experiencing patients, that's another thing. Patient care comes with its own pros and cons.
Yeah, absolutely. And I wish we had more time to dig into that. I always like to hear your favorite patient stories, but before 4, what is that? You've been giving great advice, Dr. Killop, but any other final word of wisdom you'd want young people who are exploring to know or maybe are thinking about this?
Thank you. Final word of wisdom. I would say, again, there's so much opportunity for optometry to grow as time goes on. We're getting to a place where everybody is getting old, everybody needs eye care, but also more eye diseases are coming out from things like the rise in digital devices. So if it's a profession you haven't heard until now, look into it.
I love that. You've been an amazing role model today. Thank you for putting together such great information for us and helping us get through so much.
Absolutely. I will stop sharing here if I can.